So in part 4, we're going to be talking mainly about patient demographics, but I'm also going to touch on this data collected slide. So for this specific study, they categorized their data in 5 different groups. And the reason why they did that is because they drew their data from 3 different databases, as I already mentioned before. So you'll notice for some studies, it's really important to note what data was collected. And the reason why it can be relevant is because, say we're looking at hypertension and they don't collect any information about comorbidities. Well, that's a big red flag, because we absolutely need to know, do these patients have diabetes? Do they have other risk factors that could either make them more likely to have worsening outcomes? Are they super healthy and hypertension is the only thing they've got going on? Do they have some, disease that would negatively affect their results? Say they have, say they're pregnant and they only have gestational hypertension. These are all things that we really need to know about what data was actually collected. And another reason why data collected might be a helpful slide for you to include, because oftentimes preceptors will have questions about, well, did they collect this adverse effect or did they collect this lab value? For example, one time I was doing a presentation about an ACE inhibitor, and the study itself didn't really touch on serum creatinine. Well, we know that ACE inhibitors are renally excreted and work in the kidneys as well. And so we need to know what happens to serum creatinine when they're on this medication at this dose. So it's really important to know, did they collect the correct monitoring parameters? Did they collect, if the other medications, say they're on more than one antihypertensive, we need to know that. So sometimes it's helpful to explain what data was collected. However, I would avoid making long lists. I would avoid just listing out everything collected, because that's not really relevant. If someone has a specific question, you can address that. So this slide is very much optional. It might be helpful in some circumstances, but it really just depends on the study. So the rest of this mini lecture, we're going to talk about patient demographics. So patient demographics, again, super important. And the reason why is because we need to know, is this study generalizable to other patient populations? Is this study generalizable to our patient population? And does this study, is there any bias or skewing of the data? So for example, say we're looking at, again, our patients with hypertension. If one group has way more, let's say if one group has way more BPH, then we know that, well, some of those medications for BPH, they, minutely affect blood pressure. And if one group has way more BPH, they might have, a little bit lower blood pressure because of their, average blood pressure, I should say, because of those medications for BPH. Similarly, if we have, say we're talking about patients with anxiety, if we're looking at only psychotropic medications, but yet one group is on way more propranolol than another group, which we know propranolol can be effective for some cases of anxiety, then that's going to skew our data. So similarly, we need to know, are the 2 groups, do they match up, or 3 groups or 4 groups? And we also need to know, how sick were the patients? So how many comorbidities did they have? Do they have comorbidities that we would expect in the study population? If we're looking at patients who have a lot of heart attacks, say the study is about heart attacks, and they don't collect information about lipid modifying agents, that's a huge key piece of information that we need to know. And if one group is on way more statins than the other, that's going to skew the data a lot. Most likely, I should say. So patient demographics are very important. So another thing that you can do when explaining your patient demographics is just summarize. You don't need to go down the list and read every single data point. In fact, don't do that because it can be a little bit boring to hear someone just list off everything. So focus on what's really relevant and what's really important. A lot of times studies will collect way too much information on purpose because better to have too much than too little. Similarly, better for you to have way too much information, but only talk about the key points. So, and I'm not saying include way too much information on your slides, but better to pare it down to the things that are really relevant. So one of the ways that you can do that is use red boxes, use circles, use pointers, whatever you need to use. So in this specific study, I just noted that there was a little bit of a skew in the breakdown of the race of the patients in question, and so you can use that to kind of illustrate, well, this is something that could have been better. This is something that I think is appropriate, or this is something that reflects practice. And so you can kind of use your patient demographics to explain that. Another thing is you can just make kind of generalizations, such as a quarter of the patients had hyperlipidemia and that's normal for this, or just tell a story with the patient demographics. Another thing that I just want to note in finishing up patient demographics is that if you are going to copy and paste any kind of chart, so I copied and pasted this chart, absolutely make sure it is readable. And that's just like one of the easiest things that you can do is make sure it's readable for your audience, because no one really wants to squint at the screen and it looks really unprofessional on screen if your preceptor can't even read what's going on. So I would say, in my opinion, it's okay to copy and paste, but if you can't make it readable, and if the chart is just way too big and that's not what you want to draw the audience's attention to, make your own graph, because it's going to look way better and it'll be easier to show the audience what's important.